Councilmember Mercedes Narcisse. Good afternoon. Please welcome from the New Hope Christian Fellowship Church, Bishop Orlando Findlater.
Where am I going?
Stage. Please welcome from the Public Employees Federation, President Wayne Spence. Please welcome Assembly Member Brian Cunningham. Please welcome State Senator Zelnor Myrie. Please welcome SUNY Chancellor John King. And please welcome the SUNY Downstate President, Dr. Wayne Riley.
Good morning. What a great day at Downstate. Yes. And it is not often that one has the honor to host the governor of the great state of New York. And let me tell you about this great governor. For those of you who do not know, she's a native of Buffalo, where she was raised in a very boisterous Irish Catholic family that instilled in her a number of values. And one of the values she talks about all the time is the value of service, of giving back, that was instilled in her home. That is the animating character of our governor, that she cares deeply for you and I and for all New Yorkers. And so it's very fitting that she would honor us by her presence today to announce and underscore the historic commitment that the great state of New York and she is making to one of the most admired health sciences universities in the world, and that's right here in Central Brooklyn. You know, governing is hard these days, and our governor is very active. She's committed to children and families and making sure every big city in this great state and every small town in upstate or western New York gets the services, the attention it needs so that those families and those children in those areas can go on to lead great lives and contribute to the betterment of New York. So, ladies and gentlemen, without any further ado, and with deep appreciation on behalf of all of my wonderful colleagues and, more importantly, the patients we serve, to thank the 57th governor for her commitment, for her presence, Please join me in welcoming the 57th Governor of the great state of New York, Kathy Hochul.
Thank you. Thank you. Central Brooklyn in the house? Then I am in the right place. It is a glorious day. It's an historic day. It's a beautiful day as we celebrate a transformative $1 billion investment in SUNY Downstate Medical Center. $1 billion. We got it done. We got it done. And we're doing this to secure a brighter future for the doctors and nurses. Let's give it up for the doctors and nurses. The dedicated medical students. Let's give it up for our students. And best of all, the people of Central Brooklyn. It doesn't happen by itself. A lot of incredible people helped us get here today, and I want to thank Dr. Wayne Riley, our president, for having a for believing in this institution, this place, to take care of people in their great time of need. I want to thank him for his leadership over and over and over. We are so blessed to have you in this role. I want to thank you also, Dr. King, Dr. John King, the Chancellor of SUNY. He has made it happen. He was a driving force as well, made sure this happened because he cares deeply about it. He's like a parent of a big family, right? Got a lot of institutions, SUNY Downstate, SUNY Upstate, and a lot of colleges and universities, but I know he cares so deeply about this place. We also had Fred Kowal, the president of University Professors, United University Professions. Fred, thank you so much for your hard work and all the labor members who are here today. Wayne Spence, the president of the Public Employee Federation. Wayne, thank you. And we are so fortunate to have a national leader with us here today, our very own, but America's leader for teachers, Randy Weingarten, the president of AFT. Give it up for Randy. Partners in government. We have someone I think you all know very well here, Senator Zellner Myrie has joined us. Assembly Member Brian Cunningham is with us. Assembly Member Monique Chandler-Waterman has joined us. Council Member Mercedes Narcisse is here. Council Member. And I have to make sure you know three people who were instrumental from my team in getting this over the finish line. Please give it up for Karen Persachilli-Keogh, the Secretary to the Governor, Stacy Lynch, the Chief of Staff. Stacy, thank you, Stacy. And Brooklyn's own Debbie Lewis. Yeah. They make me look good, don't they? Yeah. I'm keeping them around. They're good. They're good. You know, the legacy of this institution runs so deep. You know, President Eisenhower himself was here to lay the cornerstone back in 1954. But over 165 years, this hospital has been a vital safety net facility taking care of God's children every day. Yeah. And when I think of God's children, I also have to recognize all the clergy who were part of this effort. Yeah. They kept Bishop Finlater, you'll be hearing from him, Bishop Orlando Finlater, Louis Straker. So many of the clergy came together, and I heard from them directly. Believe me, when I saw someone has a direct line to God, I'm paying attention, right? You gonna put in a good work for me after this one, all my clergy? All right, I just want to make sure I've got it covered. Got to cover all the bases. So the clergy were so instrumental, but everyone knows it's a basic human right to have quality health care by professionals in a facility that is worthy of the people. And we've had that for a long time, But then things got a little tough. If you don't make investments, if you don't invest, then things deteriorate. Now, this is still a great facility. It is an amazing place.
Yeah.
But I think we can do better.
Yeah.
I think we can do better by the people of Central. I think we can do better. Because we serve over 300,000 Brooklyn residents every single year. And this reflects one of my priorities, that everyone does have a right to first-class, high-quality health care in everyone's own community, and especially in historically underserved communities and amazingly diverse Central Brooklyn. I just walked the streets of Little Haiti. And I'll talk about this later, but it's hard to see people, God's children, living in fear. People who came here with legal status, legally here. And one day they wake up, or will wake up in August, and it's gone. So I will tell you, when I think about Central Brooklyn and diversity and people from the Caribbean and all kinds of places around the world, the growing Latino community, black and brown, people are also feeling under siege. They're feeling sometimes unwelcome in a state that is known for being welcoming. But I want them to know when you walk in the doors of SUNY Downstate, we're going to take care of you.
Yeah.
We're going to take care of you with the very best health care, because you deserve it. Now, for almost 2 decades, this institution's been struggling a little bit. Like I said, falling into disrepair, finances were unstable, and some would say, what was happening to the care? Now, I don't question the caregivers. Our nurses, our doctors, our administrators, our professionals here are nothing but the best. And the people yesterday, they're nothing but the best. But they need the resources. I just walked into a room where women have been delivering babies since the 1960s. Okay? Things have gotten a little better in some other places for moms delivering babies. I mean, my kids are kind of old. My daughter's expecting her first baby in about 4 weeks. So I'm on baby watch right now. If my buzzer goes off, I'm out of here. But I know the women of this community deserve a beautiful experience. They should be alone. You don't have to share the space. You don't have to, I've been through it. You want to kind of be alone. And I think this is what we're going to give them in an emergency rooms that are going to be worthy of the people who live in this neighborhood. We're going to make these changes. And I know we can do it. I'm sorry that in the past, people didn't see how important this community was. Yes. And over a decade, and they didn't hear the alarms going off, and they didn't pay attention and make the investments. So when I became governor, it was right on my lap. I knew immediately we had to start building a team and work to restore high-quality health care in this community. So it starts with money, starts with the budget. So over the last 2 consecutive state budgets, and again, I give a lot of credit to your state representatives who are here today. They never left me alone, okay? They were aggressive, they were strong, they were doing their jobs. They were doing their jobs. And that's why we fought for and secured $750 million in the 2 budgets right there for SUNY Downstate. And then there's more. I know you're all thinking, did she just say 750? We thought it was $1 billion. I can do math. I know how to do this. We work closely with the state legislature, SUNY, our labor leaders, community stakeholders, and clergy to chart a long-term future for this institution. So we directed SUNY to dedicate its annual $50 million in capital allocations for the next 7 years, and that's where the other $350 million come for, totaling $1 billion investment. $1 billion. Let's say that again. It sounds so good. $1 billion. $1 billion. I wasn't leaving any money on the table, don't worry. Second, my administration established a community advisory board to develop a roadmap for revitalization and ensuring that this hospital can continue providing high-quality health care for generations. And this advisory board has done extraordinary work. They're here today. Raise your hand if you're part of the advisory board. Stand up, take a bow, advisory board. Thank you, thank you, thank you. They held hearings. They had to center the voices of the community stakeholders and hospital leadership and the union members. It was not an easy job, was it? Okay, we love you now. And they had to carefully review the local health data. I mean, got to look at the numbers. You know, what are we solving for? Tell us the data. And make sure that we could look at this again in the long term to take care of systemic long-term inequalities, inequities that surround healthcare, not just here, but everywhere. So they're working also with financial experts to assess the way for a long-term, stable financial future. So we can get that done. So they finalized their recommendations. I'm reviewing them closely right now with my team, and I want to make sure we can revolutionize the whole patient experience here. We can get that done. And the students, to make sure that they have the opportunity to have not just a great education, but a first-rate, best-in-class education, state-of-the-art learning facilities that they deserve as well, and restore this institution to its rightful place, reputationally, as the very best, because this community deserves nothing but the best. And I'm grateful to the community board, friends in labor, government, clergy, who all made sure this was going to happen. So let's get started. Let's get started. I'm impatient. I want to make sure that anyone who walks in the door here knows that they're going to be taken care of, that there are people outside this incredible, incredible community, even all the way up to Albany and across the state, who care about what happens here. That is my commitment to you. I may have said this 1,000 times, but I am New York's first mom governor. And I look at everybody. Everybody's my family. Everybody is my child. And I'm going to continue making sure that not just are you safe and secure, you can afford to live, but when it comes time to get health care, you have nothing but the best. Thank you very much, everybody. Thank you. Thank you for working with us.
Thank you, Governor.
Appreciate that so much. Thank you. Let me introduce Chancellor John King.
Thank you so much, Governor Hochul. Can we give another round of applause to the governor for her commitment to Central Brooklyn? Thanks to Governor Hochul's leadership, we will now have more than $1 billion to ensure that Downstate provides state-of-the-art modern care. I want to particularly thank my colleagues on the Downstate Community Advisory Board for all their incredible hard work, the many hours poring over data, listening to the community. I want to recognize Citizens Budget Commission President Andrew Ryan. I want to recognize Pastor Louis Straker. Yes. Dr. Leslie Kernasant from Brooklyn Plaza Medical Center. SUNY Downstate's own chair of the Department of Family and Community Health, Dr. Anitza George. Primary care physician and owner and CEO of Dr. Moore and Associates, Dr. Donald Moore. Former New York City Health and Hospitals executive Claire Patterson. I also want to recognize UUP President Fred Cole and New York State Health Commissioner James McDonald. I also want to take a moment and recognize SUNY's incredible Senior Vice Chancellor for Health and Hospitals, Val Gray, who did tremendous work on this project. And her colleague, our SUNY Director of Healthcare, Workforce, and Strategic Initiatives, Caitlin Bertleff. Now, as the governor described, we come to a place where we knew that the building was struggling. We knew about the flooding and the temperature issues and the challenges of keeping patients and staff safe. We knew about the financial challenges, the $100 million deficit, the risk of running out of cash to continue to operate. But where other people ignored the problem, Governor Hochul and the legislature stepped up. They stepped up. That's why we have over $1 billion to invest. They charged the Community Advisory Board with listening carefully to the community, developing a reasonable, scalable, and fiscally responsible plan. And this plan is that. It not only maintains existing inpatient and outpatient services, like the neonatal intensive care, like the kidney transplant program, but it also will ensure that the patient rooms that are now, so many of them, double occupancy without showers, are converted to single occupancy with showers. And in a borough where cancer and heart disease are the leading causes of death, a new annex with ambulatory surgery care will expand Downstate's ability to deliver life-saving oncology and cardiology care. Now, not only is it important that there's this investment in the hospital, but as the governor referenced, SUNY Downstate Health Sciences University is a hugely important institution for the community, preparing diverse healthcare professionals that stay in New York City. And by investing in the hospital, this effort also strengthens the Health Science University and ensures that Downstate will continue to graduate excellent students for generations to come. Now, as SUNY Chancellor and as a son of Central Brooklyn, I'm deeply thrilled that this day has come. I've long said that the healthcare needs of this community should be our North Star in this process. SUNY Downstate not only serves this community, but trains the next generation of diverse medical professionals equipped to address longstanding and systemic disparities in health outcomes. I am always immensely awed by the dedication of the faculty and staff, the promise of the students here, and the strength of this community. Now, thanks to Governor Hochul, our legislature, and the advisory board, they will soon have the hospital they deserve. So without further ado, I'd like to introduce a champion for this community and a longstanding advocate for SUNY Downstate, Senator Zelnor Myrie.
What a day. I really want to thank the governor for her commitment to our community. I want to thank the chancellor. I want to thank the Community Advisory Board. I want to thank the workers at Downstate. I want to thank our clergy who elevated this every Sunday, every Saturday from the pulpit, made sure that the community was aware. But most importantly, I want to thank the community. Yes. The community had to walk past trucks during COVID. The community served by doctors and nurses wearing garbage bags. Our community. If you breathe our air, if you drink our water, if you eat our food, you were there, you heard the sirens every single day, every hour on the top of the hour. But this has also been an institution that has given us much joy. Babies born here, lives saved here. This has been our downstate. So it is with immense pride that we stand before you today. Immense gratitude for this investment finally, into an institution that is worthy. We are 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 worthy. So look, they told me I had 2 minutes. So I'm not going to take up too much more of your time, except to say, when we fight, we win. And I want you to look at the people on this stage, look at the people next to you in this auditorium who fought every day to get this right. We are grateful to you. We are grateful to the community. And finally, we got it done. Thank you very much.
Thank you, Senator. It's now my honor to introduce Assemblymember Brian Cunningham.
It's Brooklyn in the house. It's downstate in the house. Our fighting people in the house. Let me just say, Monique and I just drove 160 miles from Albany to be here today, to stand on this stage, to say thank you, Governor Hochul, $1 billion. Thank you. Senator Murray, I encourage you to look to your left and to your right. So please look to your left and look to your right. Look ahead and look behind. This is what community looks like, and this is what it looks like when we fight together. This is what unity looks like. So to all the doctors, all the nurses, the chancellor, and everyone here, thank you so much. Thank you for not investing in a budget line. Thank you for not investing in a dollar sign, but thank you for investing in our community. Thank you so much.
Now, we have been blessed, as you've heard from the governor, the chancellor, and the senator, by the support of the faith leaders of Brooklyn. And so I will call upon now Bishop Orlando Finlater from New Hope Christian Fellowship on behalf of the clergy. Bishop Finlater.
Good afternoon. Community Advisory Board, don't get nervous. I didn't come to fight. I didn't come to demonstrate. I came to celebrate. What a great day it is here in central Brooklyn. Governor Hochul, thank you. Thank you for listening to this community. Thank you for responding to us and giving this institution the resources it desperately needs and deserves. To our elected officials who have stood tall, you've heard their names, but I have to recognize them again. State Senator Zelnor Myrie stood tall. Assemblymember Brian Cunningham. It's not in her district, but Assemblymember Monique Chandler Waterman has been fighting with us. To the staff, you have taken care of this community. You have taken care of this community. You have served well. We appreciate you. To UUP, Dr. Fred, Dr. Redifa, thank you. I only have 2 minutes, y'all using up my time. To PEF and Dr. Oh, yeah, I'm going to make him a doctor.
The other way.
Wayne Spence. Thank you, thank you, thank you, thank you. To my colleagues, the clergy, can the clergy please stand?
Yes.
The clergy speaks for those who have no voice. Last year, January, we told you we'll stand with you. And we also told you we'll have victory. Guess what? We have victory. Because the people united will never be defeated. God, we thank you for this institution. Bless SUNY Downstate. Cause this institution to minister healing to those who are sick and in need of care. I pray that you'll grant to Dr. Riley and his leadership team wisdom. Honor the faithfulness of these dedicated public servants. Oh God, bless SUNY Downstate Medical Center. Bless Chancellor King and his team. Bless this community. Bless our governor. And bless the great state of New York. Yes. The Lord bless you all.
Please welcome to the podium the President for the Public Employees Federation, Wayne Spence.
All right. So what them always do to me, when we come up after the clergy. And it's a tough act to follow.
Very tough.
So before I start, this could not have been possible without the workforce. But not just any workforce, a unionized workforce. I'm gonna ask the unionized workforce, everybody who's in here, who's in a union, please stand up. Thank you. So I want to thank you, Governor Hochul, and your dynamic team for hearing the community, listening to us as stakeholders, and to taking decisive action for SUNY Downstate. We've been through this fight before, and it was not a fight that you started, but I'm glad that God had a mission and a reason for you to be here when we had to do this again. I don't have a lot of dealings with politicians, that much. Most of the time I deal with their staff. But there's not many times when you sit one-on-one in a room with someone and you can see the empathy behind their eyes. And I can tell you that from about this governor. And I appreciate it. Yes. And I appreciate that. Thank you to the community itself, the residents, families, and advocates who stood up, spoke out, and fought to save this essential institution. Your voices made the difference. And this was not our first time. To the dedicated professionals of PEF and UUP who work here at Downstate, thank you for raising awareness of the life-saving care you provide every day. Your expertise and courage was central to this outcome. $1 billion. That's a big outcome, y'all. That's real money.
Yeah.
That is money that I ain't got to go back and beat up on Kevin Parker when I see him at caucus weekend. Because I did used to beat up on Kevin when I see him at caucus weekend in the elevator at the Hilton. I've been begging him every year since 2015. And I am glad that won't happen again. To God be the glory.
Amen.
I'm incredibly proud of the coalition we built, one that came together swiftly and purposefully on Martin Luther King Day a year ago when the SUNY Chancellor first announced that there has to be some type of transformational plan. From the day forward, we never wavered. We never gave up on Downstate's future, and today we celebrate the future. We celebrate that future. Downstate has endured decades of disinvestment and neglect, and that ends today. From the start of this fight, we stood united under a single motto: Brooklyn needs Downstate. And in that campaign, we shared that what could not be ignored, facts that justify the $1.1 billion investment that the governor has just committed. 60% of Downstate's 2,000 students are people of color. The medical school ranks in the top 4% nationally for graduating black doctors and nurses. This institution pioneers the invention of the MRI. It operates the only kidney transplant center in Brooklyn. And is home to a level 4 NICU, providing the most advanced care for our newborn. No more traveling to Manhattan to get quality care. No more. SUNY Downstate has earned this investment, and today the medical staff, the faculty, and the Flatbush community could celebrate this victory. So again, we started with Brooklyn need Downstate, and now Brooklyn has Downstate. Thank you.
That concludes our program. Thank you for attending. We look forward to seeing you again.
One more photo? Oh, group photo? Okay.